Some weeks ago, I was invited at the Congress in Germany. And one of the topics at this Congress was, of course, emerging markets. And you know that are working in business that emerging markets, of course, is a very hot topic. And there's a lot of talk about it. But in the course of this conference, when people spoke about emerging markets, I was wondering, do they really talk about emerging markets, or do they really only talk about a very specific income segment in the emerging markets? The Indians would call it the creamy layer. You know, people highly affluent, well off, a lot of income, but not really many people. Whereas the biggest part of the emerging markets are not that well off, and you have a high volume of people. And then one of the senior managers that was speaking there, he brought an example, I believe, in a very honest and humble way. He said, recently I went to India and I met some very, very innovative and young researchers. And they were looking at vaccines, how to develop them and how to produce them. And he told them, or he asked the question, why are you doing this? You know, it's not so difficult to develop a vaccine. And then the Indian guy said, you don't understand. It's not difficult to develop and produce a vaccine for $40 a shot. But it's very difficult to do this for $1 a shot. And I believe this example was so striking because it illustrates very well where most of the multinational corporations are operating. They are operating in a space where you're just serving the well-off people in the society, but not the majority of the population in the world. And you know, if you look at this income pyramid that is shown on the slide, you see this very obviously. The business models of most multinational corporations are just not working in the bottom or even in some parts of the middle of the pyramid. And if you look at the development, you can see very clearly that the bottom will grow into the middle of the pyramid, so it clearly indicates that there's a big market potential. But the question is, are we ready with our business models? Do we have the right ones? And how can we get and develop this market? There's also a lot of talk about, is there really a level of income available in this market so that people can spend money and that you can make money there consequently? And if I just look at data that was published in 2007 related to the pharmaceutical industry, the World Resource Institute, that has done great work, found out that alone with regards to pharmaceuticals, there's a market volume of roughly 57 billion US dollars. And I believe that's a highly attractive market segment to be invested in. But one thing is still very clear. Even if the bottom of the pyramid will grow into the middle of the pyramid, a lot of challenges will remain. And this chart is also indicating very clearly that classical models of development aid that are based on charity and philanthropy will not work. Because the scale of the challenge is just too huge. You cannot write that many checks in order to provide healthcare delivery to the many, many, many billion people in the world that need it. So we need scalable, business-minded models in order to improve healthcare, and this is what we care about in Novartis, that we can improve healthcare in the bottom of the pyramid. Now, I'm showing this slide because it indicates to you how difficult it is to deliver healthcare products, especially in rural markets. That's a situation we are not faced with, but that's the reality of people that are living with $1 or $3 a day. So the question for them is, and Venki has already Iqbal has already spoken about it, the question is there a health service available near to the patient? Or does the patient need to walk 20 or 10 miles in order to get to a clinic or to a doctor? And never forget, very many of these people, they have daily wages. So if they have to walk or travel one day to get to a health center or health facility, they lose their income. And this is something that is, of course, very difficult for them to bear. Then the question is there some sort of infrastructure? Mostly not. So they have to do it by walking or by bike or whatever. It's very difficult to go, to find the right way to the health facility. Then, of course, the question of the price is a very relevant one. If they reach the health facility, can they pay for the treatment? Awareness. Especially in rural markets, you see very often that patients are not aware of disease symptoms. So the level of health-seeking behavior in these markets is very low. And last but not least, how good is the quality of care in these kind of markets? And this is, of course, related to the service that is provided by the healthcare professionals, but also by the products that are provided to the patients in these markets. This is a very classical set of factors that are constituting health outcomes, not only, of course, in the bottom of the pyramid, but also in other market segments. But in the bottom of the pyramid, it's especially difficult. Now, what have we done in Novartis? In 2007, we have embarked on a journey where we tried to find a business model in order to reach patients in the bottom of the pyramid. And this business model is called Arogya Parivar. It's Hindi and means healthy families. And with this business model, we try to address some of the factors that I've just shown previously in the slide before. When I talk about Arogya Parivar in India, keep in mind 700 million people are living in rural India. Most of the healthcare spending is out of pocket, so there's no insurance scheme. People have to pay directly when they go to the physician. Most earn less than $3 a day. And of course, as I said, the education level in terms of health-seeking behavior is rather low than high. So what have we done in order to address these problems and challenges? So first of all, we looked at the customer. We looked at the biggest disease burdens in India. What do the patients really need in rural India? And because we are a diversified company, we looked at a broad range of portfolio and said, how does the disease burden match with the portfolio, with the products we have in our portfolio? And we brought these two things together. Meanwhile, we have roughly 79 products in 11 disease areas that are part of the Arogya Parivar product portfolio. But of course, we also looked at the question of affordability. So we tailored the package of the products. And of course, especially with regards to the affordability of the patients. It doesn't make sense to bring a package of 20 pills if the patient can only pay one, right? So you have to tailor this kind of packaging. And it was also very important to tailor it in terms of language. In India, you have so many different languages, so you have to bring it to the patient in a language that is understood by the patient. That's more or less the supply side. But then we also looked at the demand side, and we built a complete service package around the patient. So we have hired roughly 300 educators that are going from village to village and bringing the people in the village together and are talking with them about diseases, disease symptoms, treatment options, what should you do first when your child has diarrhea, etc. This is not talking about products. This is talking about general disease awareness and what you can do if you're affected by a disease. And the focus is very much on maternal health and, of course, on prevention and child health. Next to this, to these educators that we have assembled together, we have so-called supervisors. And these supervisors, they are going from doctor to doctor, from pharmacist to pharmacist, and they are doing some sort of health training with them, but they are also selling our products to the healthcare professionals so that we can close the loop, so to say. So when the patient goes to the doctor is aware about the treatment options, and the pharmacist, he has the drugs in stock that the patient needs after he has received the prescription of the doctor. And these are the results. As said, we started with this in 2007. It was a bold commitment of our senior management, I believe. And meanwhile, we are reaching roughly 42 million residents in rural India, which is quite a high number, I would say, for this kind of social business model. We are partnering with roughly 39,000 pharmacies and doctors in rural India. And then the third bullet point is, of course, of a special interest for us, because it shows that you can do these kind of things on a sustainable level. We have broken even after roughly 3 years, and we are running this on a profitable basis now. And because we are running this on a profitable basis, we are able now to expand this to other countries. And this is exactly what we need. We need business-minded models that are scalable and replicable, because if you make money with it and help the patient, you can help many more patients than you could with charity and philanthropy. As said, this is not the whole truth, and this is not the end of the way. I believe that's just the beginning. And that's kind of way how we try to approach at Novartis, creating shared value, social business, social innovation, or whatever. And when I think about this model, and I'm here at the Drucker Forum, I think we have to remind ourselves very often what apparently Peter Drucker said once. He said, bankers believe they understand the business. They believe business is about making money. They are wrong. It's about making shoes. And here it's about delivering medication and treatments to patients that really need it. And again, do it in a business-minded way so that you can scale it up and be really successful in many more markets. Thanks a lot.